Hey, JD here, and today we're going to talk about a wrap up kind of summary overview of why you should optimize your testosterone levels and kind of go through some FAQs and some summary points. Okay. So, we're going to cover a review of what happened and what we talked about in making sure that your testosterone levels are covered. It's going to be kind of a recap of the TRT Secrets class. Okay. And we'll also talk about a few questions that are common to those on TRT. So let's jump into it. So today, millions of guys suffer from lower sex drive, fatigue, tiredness, difficulty focusing, indecisiveness, and lower levels of enthusiasm for life. And a lot of this is happening because of chronically low levels of testosterone. The scientific diagnosis for that is male hypogonadism, and it's a recognized medical condition, frankly, in which the human body does not produce enough testosterone, right? So the challenge today is this condition remains dangerously underdiagnosed by many doctors for a variety of reasons. Insurance companies do not like to kind of go through the protocols of prescribing TRT. Also, TRT is a controlled substance in the United States, and so a lot of doctors get scared off by that, regime, right? So this is important today because lower concentrations of testosterone increase your risk, okay, for age-related diseases, depression, and infertility, and other types of risks, right? And issues. So throughout this webinar series, we've kind of talked about the use of TRT and how it's a game changer. To basically kind of explain further, we're going to go through kind of a position from the Mayo Clinic regarding testosterone deficiency and treatment. Okay. So this is a position statement from Mayo Clinic, right? Word for word, verbatim. The basic gist is, testosterone deficiency is a well-established clinically significant medical condition that has negative effects on male sexuality, reproduction, general health, and quality of life, right? So the symptoms and signs, occur as a result of low levels of testosterone and, may benefit from treatment, whether there is an underlying etiology, right? So TD, testosterone deficiency, is a global public health concern. And so testosterone therapy, okay, for men with testosterone deficiency is effective, rational, evidence-based, right? And so, there really isn't a golden number in terms of the testosterone threshold that reliably distinguishes those that respond to treatment and those that will not, meaning that you need to kind of look at your symptoms, you look at your clinical observations, kind of how you feel, and then see kind of what the right levels are over time, right? 1,000, total T for some people is different than 900, 800, so forth, right? And it all depends on kind of how you feel, right? And, there are limited scientific findings and basis for, age-specific recommendations against the use of testosterone therapy in men. So the evidence does not support increased risk of cardiovascular events with testosterone therapy, and does not also support increased risk of prostate cancer with testosterone therapy, right? So, by and large, there are some major benefits of testosterone replacement therapy, in terms of preventative action against cardiometabolic diseases, right? Diabetes and so forth. And so, with this baseline from the Mayo Clinic, right, we're going to go review the benefits of testosterone replacement therapy, okay? So let's go over it. So in summary, if you think about optimal testosterone levels, you think about better focus, elevated mood, more confidence, right? Increased muscle mass and decreased body fat, a healthy heart, and maximum athletic performance and high sex drive. So let's summarize that, right? So testosterone replacement therapy will 10x and multiply effectively your habits. If you're drinking a gallon of water every day, getting a consistent sleep schedule, if you're working out 3 to 5 times a week, this will multiply it out, right? And amplify you, right? And so we're going to kind of quickly review each of these and see how kind of, testosterone starts with optimizing your mind, right? So TRT exerts powerful biological effects on brain development and brain function. How? By increasing dopamine, alleviating depression, improving cognition and memory, and ultimately working against preventing Alzheimer's and dementia, right? So testosterone's most notable effect on the brain is its ability to enhance dopamine, This is responsible for transmitting signals between the nerve cells and the brain, and the brain is heavily dependent on dopamine to, testosterone to boost dopamine, as it's one of the keys behind a robust sex life, right? And also kind of the reward centers in the brain, right? So your ambition, your enthusiasm for life, and so forth, right? And so having an increased dopamine level will result in a more positive outlook and a more energetic state, and that compounds to be more productive, more successful, and so forth, right? After beginning a TRT regimen. So research now demonstrates that men going through TRT for suboptimal levels of testosterone report, improvements in mood and other issues related to depression, right? A few other studies have shown that TRT may have an antidepressant effect in those that are depressed and those that have hypogonadism, right? Okay, and that, as we remember, that is the condition in which the body does not produce enough testosterone. Okay, so other studies have shown that testosterone improves working memory in men. Working memory is the basis for nearly everything needed for proper brain function and productivity, right? So advanced studies have shown that visual and verbal memory and cognitive processing improve in men who are given testosterone. So, testosterone, TRT's ability to improve memory and increase cognition is quite possibly its most pronounced effect. One way to think about it is it makes your body, which is a system of systems, run more efficiently, right? And so that's kind of very interesting, right? So let's go review kind of